All right, thank you all so much for joining the Spanish Language Hispanic Latino Outreach RFA webinar. We sincerely appreciate all of you who submitted questions prior last week to Erin Flynn. She was out on annual leave this week and wasn't able to participate in this webinar, but she will be managing the contracts available through this RFA. My name is Allie Maffey. I am the Retail Marijuana Education Program Manager, and with me I have Heather Link Bergman.
Hi everyone, I'm the Marijuana Communications Specialist. I'm here to help answer any questions you might have about the campaign work we're doing.
So the Retail Marijuana Education Program was authorized in statute in Senate Bill 14215 to accomplish these 5 objectives: an 18-month public awareness campaign, including fact sheets and clinical guidelines, ongoing education and prevention for specific populations and specific behaviors, such as anyone at high risk from marijuana use or exposure, preventing the overconsumption of edibles, reaching out to retailers to be able to educate them about the importance of restricting youth access, etc. Also maintaining the colorado.gov/marijuana portal, and aligning and supporting statewide integration. So that's by providing TA training and support for local programs and policies. And then lastly, like any good public health program, making sure that we're evaluating the effectiveness of this work. Just to give you a little bit of a background in what we know to be true about marijuana use within the state at this point, the Behavior Risk Factor Surveillance System, for the very first time, asked questions regarding marijuana use among adults 18 and older. You can see here that the Colorado average was 13.6% of adults over the age of 18 reported having used marijuana in the last 30 days. And you can see by region broken down their top quintiles. So the darkest blue areas are those with the highest marijuana use, all the way down to other regions with the lightest marijuana use. The most populous regions, for instance, El Paso County is its own region, Pueblo County is its own region, Denver County is its own region, but some of the less populous areas have to be combined into multiple communities into one region in order to get a statistically significant rate of marijuana use. That was the first time this information was asked on the Behavior Risk Factor Surveillance System throughout 2014, so we were not able to compare to previous levels of use. So you will see here within the 2014 data of the 2014 BRFSS, the rates of use broken down by household income as well as by race or ethnicity, and we were able to ask about gay, lesbian, bisexual adults. And what you will see here that I wanted to highlight is that Hispanic adults tend to use at a slightly lower rate than the overall average statewide of 13.6%. They were just below the overall average. However, you will see that we actually have slightly higher rates among Hispanic youth for the ever use and for past 30-day use. So that is, the blue line is ever use and the green line is past 30-day use, compared to the statewide average of 19.7% of adolescents reported past 30-day use, and you'll see that the Hispanic rate is slightly higher. So we do know that reaching the adults with information, despite the fact that they may not use at the same rate as the general population, but in order to have educated communities about what the laws are, about the health effects, that they can become resources to the adolescents in their lives and be able to help prevent youth access is very important. Additionally, through our evaluation of these efforts, that was one of the 5 tenets that you saw at the beginning of this work, you saw that we are evaluating the work that we're doing, and we were able to conduct surveys both in English and in Spanish and compare the results of those surveys between the 2 populations. And what we saw is that only half of our Spanish-speaking population that responded to the survey knew that the legal age limit for use was 21, compared to 77% of English language respondents. So overall, that average was pretty consistent with lower levels of knowledge of the laws. However, we did see higher agreement with the risks. So among the Spanish-speaking population, there were a few different risky behaviors that we asked questions about: perceived risk of marijuana use during pregnancy, perceived risk of hash oil extractions, perceived risks of adolescents using marijuana. And we saw between 89 and 100% agreement with nearly all of the health risks among the Spanish-speaking population, whereas those same health risks only achieved 59 to 85% agreement among the English language respondents. And so with that, I'm going to turn it over to Heather to be able to take you through information about the campaign that was developed.
Hi, everyone. Thank you for joining us. So moving along, for our Latino campaign objective, we want to provide culturally responsive education for Colorado's Hispanic Latino community on the laws and health effects of retail marijuana. Pretty simple. We launched this campaign entitled Marijuana en Colorado, lo que debes entender, on August 3rd. We have a number of tactics, so television, PSAs, radio, print, digital, a call-in line, so 1-888-C-SALUD, where the community can call in and ask questions in Spanish about marijuana and talk about their concerns. Email and text blasts, a website, so you can navigate to that website at colorado.gov/marijuana with an H, or marijuananco.com. They both go to the same place. We also have a Facebook page, and we're integrating our campaign materials into a number of events. We're also planning on conducting community outreach, which you all are most familiar with as respondents to this RFA. Our target audience for this are Spanish-speaking Coloradans age 21 and up, and just want to also add that we're looking to be able to communicate effectively with second-generation and first-generation Latinos. So just walk you through a couple of our tactics here as a screen grab of one of our PSAs with one of our campaign spokespeople, Maya Leon Mace. You can view all three videos on our Facebook page, so just go to facebook.com, marijuananco, to be able to look at those. We also have a few print executions. Here's a first one that just is generally communicating about the laws, so saying now that marijuana is legal in Colorado, it's good to get informed. It's your duty to get informed. And so these utilize our campaign tagline, "An informed community is a safe community." Here's another print execution where we're focusing up a little bit more on a specific topic area. So this one is educating yourself about marijuana so you can talk to your family, so you can talk to your children, all the loved ones in your life about marijuana. We're also pursuing a number of earned media efforts. So here again, we have Maya filming an interview segment. In this particular piece, she was talking about the website resource, talking about the PSAs, talking about the upcoming call-in line for the community to be able to call and ask questions. So we're also running digital ads. So here's an example of our advertisements. And of course, we have the campaign website. So this website is the exact same content that you'll find at colorado.gov/marijuana. We have translated it fully, but we've also included some additional links that are additionally helpful for this community. So as I mentioned earlier, we do have a call-in line available to the community that became available on August 24th and will be open throughout the end of the year, so that's something we're really excited about. The number is 1-888-C-SALUD or 1-888-747-2583. We're also pursuing a number of events, either sponsorships or presence at events, so the Adams County Fair, the Colorado State Fair, Fiestas Patrias, Entravision Health Fairs, and the Jose Anniversary Concert are a number that we had initially identified as community events where we'd want to have some presence. And then, of course, community outreach. So part of this campaign, I think what will make it successful is ongoing community sessions, including sessions with hard-to-reach populations. And that's why we're offering this grant funding to Latino serving organizations to be able to help take this campaign messages and materials and disseminate those in your communities. And so with that, we thank you for listening to our brief presentation, and I'm going to hand it back over to Allie.
Through the website, you've all been able to access the information, downloading the application packet, as well as the response to the questions that were recently submitted online. I want to take an opportunity to go through the RFA with you all and to let you know a little bit about the design of this outreach and the intention behind it. So through the communities that are funded through the Office of Behavioral Health at the Department of Human Services, and I believe those funding awards were just recently announced, and they're working on creating scopes of work and contracts with each of the awardees. There wasn't a specific Spanish-speaking outreach highlighted through the work that they were doing. And so because of this campaign's launch and our desire to make this as successful as possible, we wanted to supplement the work that many of these communities are doing at the local level through this support for community outreach at the local level in Spanish, targeting health education. So paging down, within the RFA, I'm just going to take this opportunity to go through the content. I've highlighted a few areas that I'd like for us to focus on together, and then we'll answer any questions at the end. And I'll move quickly just to make sure we allow plenty of time for questions. So here you will see that the purpose of this RFA is to fund local outreach that will leverage the Marijuana in Colorado, Lo que Debes Entender campaign, which launched in August of 2015. The goals of our work are to improve self-reported behaviors that prevent negative outcomes from marijuana, including we want to increase safe storage of marijuana products in the home, increase parent conversations with youth about marijuana, increase healthcare provider conversations with patients about marijuana, and decrease impaired driving, as well as decrease secondhand smoke exposure. Those are some of the campaign goals that we have overall. The short-term outcomes would then include increasing accurate knowledge of the laws and health effects of retail marijuana use, and increased perceptions of risk of problematic marijuana use, such as underage use, use while pregnant or breastfeeding, overconsumption of edibles, secondhand marijuana smoke exposure. I'm going to skip down to the purpose of these community projects. The purpose for these projects are to expand the reach of the existing Spanish language campaign, Marihuana en Colorado, Lo que Debes Entender, disseminating the educational materials into a community, and educating each community about retail marijuana laws and health impacts. Relatedly, down here under Section C, there are a variety of entities that are eligible to apply for this grant. However, the applicants considered for funding must currently educate limited English proficiency, Spanish-speaking Latino Hispanic community members about health or substance abuse in their current geographic area. So we're looking for organizations that already have that experience conducting health education outreach or substance abuse education outreach in Spanish. They have to demonstrate the ability to reach the Spanish-speaking community members in accordance with the national class standards, which can be found through that link. Demonstrated ability to deliver culturally responsive health information. Demonstrated the ability to reach a variety of ages within the Latino Hispanic community's application service area. And as we highlighted above, this is to reach adults of all ages, right above that. And then I want to specifically highlight number 5, in that we are looking for applicants to use the existing campaign, not to develop new communications materials. Lastly, we did have this 6th one here. There was a possible opportunity to receive funding from the City and County of Denver, and they had asked if they were able to fund one additional community, that we just assure that one community was within the City and County of Denver. However, we recently learned that we cannot fund that additional opportunity, so the overall application will be limited to 6 awards of $25,000. So 6 communities, $25,000 each, total of $150,000. And that's an up to number. Moving down just a little bit, there were a few questions that came in through the question and answer period to Erin's email address. So hopefully you were all able to see the responses to those questions. Just highlighting a few differences here. Your geographic service area is whatever you all determine your geographic service area is. The 6 geographic areas that will be funded You can also set the geographic limit of what that means, but we are looking for geographic areas that either have a significant number of limited English proficiency Spanish-speaking Latino Hispanic individuals, or if it's not a very populous county that you're reaching, you have a high density of limited English proficiency Spanish-speaking individuals in the community. The projected budget, as I just highlighted, it is up to $150,000 available for the RFA, and it can be one or multiple awardees. This is funded through retail marijuana tax dollars. Each application may request funds up to $25,000 per identified geographic area for the initial 7-month contract year, December 2015 through June 2016. The way our fiscal years work, we cannot do carryover funding. You'll see that just a little bit below. So the entire amount of funding must be realistic to be spent within that time period. This, you'll see I shaded gray because the $25,000 from Denver will not be available at this time. Additionally, proposals exceeding $25,000 per identified geographic area for the initial 7-month period will not be considered. I'm going to page down to highlight another important area, the goals and purpose. So this first section is very similar to what was stated above. The 3 strategies that we are hoping to fund, that can support applicants to achieve the short-term outcomes, are to implement the Substance Abuse and Mental Health Services Administration, SAMHSA's, Center for Substance Abuse Prevention, which are CSAP strategies. There are 6 different CSAP strategies, which include the 3 that are listed here, as well as providing alternative activities for youth, conducting problem identification and referral strategies, as well as changing environmental strategies, which would be like policy change at the local level. You will see that this funding is not intended to reach to implement those 3 strategies. However, it is intended to fund these 3, which are dissemination of information, prevention education, and community-based collaboration. So dissemination of information is often one-sided, so it's you all providing information, much of which is available through the campaign, out to a local community to be able to make it accessible to them. Prevention education is a 2-way interaction between educators and participants. So this is offering educational opportunities for parents, teachers, for community members to be able to learn more and ask questions. And then community-based collaboration. We know that there are many people invested in this issue at the local level and many partnerships that you can capitalize on, work with to be able to implement the work at the local level. How to apply. There are a variety of required documents that you'll see here, all of which were part of the application packet that you could download from the website. So attachment A is the cover sheet and signature page. You can sign that form, scan it in, and email it with your full response. Attachment B is the application executive summary. We provided a 1-page document for you to be able to use your executive summary for what your project will be implementing and how it will achieve the goals and objectives of the grant program. Attachment C is the scope of work plan, which we'll look at in a second. Attachment D is the less than 12 months budget template, and that template is set up to be able to calculate only 7 months of a budget instead of the full 12-month typical funding year. There's a contact information form, general and special provisions, so this is just something that you're required to review. That's part of all contracts from CDPHE. There's a pre-award risk assessment questionnaire form. Risk ratings will impact the overall score of an applicant. And then there's an application submission checklist. I highly recommend using the application submission checklist as it points out each of the things that are intended to be included in the application, as well as reviews some of the formatting requirements. The application narrative. Please pay attention to the descriptions that are provided about the number of pages and double or single spaced. And note that your narrative, which is limited to 20 pages, does not include your executive, it does include your executive summary, Oh, sorry, no, it does not. Sorry, I confused myself when it said including. So other attachments, including the executive summary, letters of support, and budget, do not count towards the page limit. Your application can follow this outline for what is submitted with these same headings, and that is listed below in the formatting section. But providing a statement of need and opportunity, describing your geographic area or areas if you're applying to work in multiple geographic areas, including the geographic boundaries, information about the community as best you know. You can talk about the limited English proficiency Spanish-speaking population in your area. One of the questions that came in was whether or not this document, only this data could be used. And if you have other data that is well-sourced, talking about the limited English proficiency community within Spanish-speaking community within your area, you are free to use other documents as well. We just wanted to make sure that people had easy access to one set of information about their communities. Additionally, clearly describe local priorities for marijuana education and prevention efforts, including, and you'll notice here it says include reputable data where available. We know very well, especially even at the state level, that we're pretty limited on good data about marijuana use and the priorities in the community. So as best you can, identify what resources you are using to demonstrate that you know that this is an area of concern and something that you would like to address in your community. The project design narrative, again, please be sure that you follow the 3 CSAP strategies that are prioritized in this RFA. And under the community collaborations, you'll notice this is your opportunity to talk about your current collaborations that you propose for this project. So how these collaborations can help enhance your proposed project, how you plan to engage parents and families in that work, and if relevant, how you will recruit new collaborators. Number 2 here, please note, it says please attach up to 4 letters of support from any collaborating agency listed in the scope of work plan. That's important. Letters of support are only required for entities that have a leading role within your work plan as far as implementing activities. If you would like to include other letters of support, you're allowed to, but just wanted you to know they're only required from agencies that you're working with at the level that they are listed as a lead for some of the activities in your work plan. Describe how the proposed project will ensure cultural and linguistic responsiveness. Again, you all are the experts in this area. Many of your organizations, however, may be new to some of the people who are reviewing the RFA. And so this is an opportunity for you to inform those reviewers something about your community in case they may, and your agency in case they may not know your agency well. And then our sincerest hope is that there will be ongoing funding for this work moving forward. We're currently in a pretty, we received almost a 65% budget cut from last year to this year. And so we're hoping for funding to be reinstated in future years at a much higher level, which will allow more funding to be able to go towards these efforts moving forward. So, briefly describe how the applicant will expand the activities if awarded additional years of funding. So we'd like to see how you would plan to deepen this level of information dissemination and community education. Capacity and program infrastructure, again, this is, many of you already have the expertise in this area, so we're just looking for you to be able to describe that for reviewers who may not be familiar with your work. Evidence of collaboration, this is about your past collaborative efforts. So what have you done in the past for health education? How have you leveraged those relationships in the past in order to reach your entire community? And then project evaluation, including data collection tools, pre-post test strategies, and plan for analysis of the data. We know that this is not a lot of funding, and so as available, whatever data collection tools or however you currently monitor the implementation of program activities within your program, that would be helpful for this group to know, just so we can see how you would plan to measure the implementation of this work. The scope of work, I'm going to jump over briefly because we'll pull that up as a separate document. The budget, please make sure that all calculations are accurate. This is a very key one. If you've received funding from the state before, then you're familiar with this. But the state works on a reimbursement-only basis. However, no activities done prior to the date that the contract is signed can be reimbursed. So any pre-award costs, any work that's occurring within your community now, we can't go back and pay for those at a later date. And then this is an important item to highlight as well. CDPHE reserves the right to deny requests for any item listed on the budget that is deemed unnecessary for the implementation of the project. So like I said, the funding goes through June 30th of 2016, and all funding must be spent. And so we're looking for reasonable budgets that can be spent within that time frame for the community that you are working on. So as we select awardees, we may need to negotiate slightly different budgets where we may determine that one activity that was proposed or one certain expense that was proposed may not work for that project or for that timeline. So during the contract negotiation process, after awardees are selected, that's when we'd be able to identify any of those items. Funding period we highlighted. Do want to highlight, we would love, we're planning to be able to provide an in-person opportunity for you all to meet each other and to know who else is doing this work, what your plans are for this work, and then we can share campaign resources with you all at this training and go a little bit more, a deeper dive into the data that we looked at the very beginning of this webinar. And so please include costs within your travel to attend a one-day in-person training in Denver. Other documents, don't forget to include information about your organization. Just highlighted this entire section to be sure that you notice the font formatting, spacing, requirements. One thing to highlight is that the scope of work, single space, is acceptable for this document. Submission instructions. So please continue to monitor the website in case anything new is posted. We're not planning on anything at this point. Electronic submission to Erin Flynn. Her email address is listed there, same person that you contacted with any questions. And then the timeline. Someone pointed this out, so I just wanted to acknowledge this. It says one original and one electronic copy. That was leftover template language, so we apologize if that was confusing. It is just one electronic copy submitted to Erin Flynn. And then the scoring criteria. So technical merit, how well does the application follow the guidance that was given in each of the subsections? Again, same thing applies for management capability experience, price, and compliance with the terms. Everything that is outlined in the required documentation that you submit that goes through what you're supposed to include in your application narrative and then within the budget, those will be turned into the scoring criteria for the RFA. We will have a team of both internal and external reviewers that will help to score the application. Under the review criteria, you can see the total points, 50 points for the narrative broken out into those 5 sections, and then the scope of work and the budget. The risk assessment applies an overall deduction to the evaluation score, depending on how the risk is assessed. And then scrolling all the way down under 9B, program resources and websites, there are really helpful resources through these links to be able to access the adult use data, and you can look at the regional data there, as well as the adolescent marijuana use data. There are regional data available there as well. You can get in touch with your local health departments who may already have easy access to that data at the local level, or you are always free through those websites to contact CDPHE to request a certain data run. Additionally, there's information on the CSAP strategies, the limited English proficiency data, the class standards, county health rankings and roadmaps. It's just, they have really great information about census data, information about the populations in each county, so that can help with your, as you're describing your geographic areas, it can be a useful tool. And then SAMHSA's general prevention information. A couple other things. Application prices, estimated application prices within your budget are not acceptable. That's just something to highlight. We've had, in the past, I've seen other RFAs where there's just one big, broad, general number. Sure, it's going to cost $25,000 to do all of this work without breaking it down into how that will be spent. So please do not estimate, but actually include detailed items of travel costs, of salary costs, and the work that will happen at the local level. And then RFA cancellation, as I mentioned, we've had some budget issues, so we are very hopeful for the future, but with all state funding initiatives, there's always a chance of funding concerns. So there's information described there. Let me pull up one more thing, and then we'll open it up for questions. Just want to highlight the scope of work. So here's a description of the project goal where you can insert your project communities. A reminder of the 3 CSAP strategies that are prioritized, as well as the short-term outcomes that we are looking for. And then here's the template. Please feel free to add as many sets of that template as you would like, again within the 10-page limit, where you can add additional SMART objectives, target populations, and activities. In this responsible key staff or agency, this is where you would look for those letters of support. If you're listing a different agency altogether as taking the lead on an activity, that's an agency that we would like to see a letter of support from. Or you can just include your staff. As I mentioned with the budgets, making sure that there's clear alignment between what you will need and how it will be spent. So make sure that those key staff are listed within your project budget and the relevant salaries and subsequent time included. Down below, you'll see that there's a scope of work example. Please delete this example from your final submission. We don't want it to count against you with your 10-page limit. But it's just a hopefully helpful resource to you all to see what the state looks for in the scope of work. So with that, I apologize for the late start, but I'd like to open it up for any questions. I'm going to pull open the Adobe Connect and stop sharing the screen. And see if there's any questions. No questions have been typed in at this time. Do any of you have any questions over the phone? Oh, I see someone is typing. So the question is, we can use a portion of this funding to fund direct services to the Latino population. As long as it meets the criteria of the application, yes. So the direct services are that it is education, prevention education, that it is information dissemination, and community-based collaboration in order to advance and enhance the dissemination of the Marihuana en Colorado, Lo que Debes Entender campaign into your community. So according to the application, there will be priority given to those communities that can demonstrate the capacity to reach a significant proportion, and I'm quoting from page 5 of the application right now, a significant proportion of the limited English proficiency individuals within their community. So it depends on how you define direct services, which is why I'm kind of saying more about it. It needs to be about marijuana and substance abuse prevention education. It needs to use the materials outlined within the application, and then also as long as you demonstrate the ability to reach a significant proportion of those individuals. Any other questions? All right. We've had a few participants log off the webinar and off the phone as well. So one final thing, we will work to combine this audio recording that we did on someone's cell phone with the webinar recording and make them into one video for you all and post it by tomorrow afternoon. That is the goal per the outline of the RFA, so we will do our best. We started the recording just a bit late on the webinar, so I'll try and go through those data slides at the beginning again, just for everyone's information. That will be posted on the same website. Let me share my screen again. Those will be posted here. A recording of the webinar will be posted following the live event, so we will get that uploaded there. And I highly recommend checking out the Facebook page where you can see the videos with Maya as well as the some of the print materials and messaging, or digital materials.
They look the same.
They look the same. They look like you're supposed to print them.
Thank you for your time.
Yeah, thank you all.
Have a good day.
You too.